All right. Thanks for being here today. It's my pleasure to introduce Dr. José Guillermo, aka Memo Cedeño Laurent, who is an assistant professor at the Environmental and Occupational Health Sciences Institute at Rutgers. He directs the Climate Adapted and Restorative Environments CARE lab, where his research focuses on understanding and mitigating the health impacts of climate-driven hazards, with particular emphasis on wildfires and extreme heat. His work examines the neurological health impacts of wildfire, air pollution using novel exposure assessment methods, including air pollution sensors and digital biomarkers. Dr. Laurent received his Doctorate of Science in Environmental Health from the Harvard T.H. Chan School of Public Health, a master's degree in energy engineering from RWTH, Aachen University in Germany, and a bachelor's degree in mechanical engineering from Tecnológico de Monterrey in Mexico. And I'm lucky because I got to meet Memo about 3 years ago. We're part of the same fellowship program that is for junior faculty who work at the intersection of environmental health and environmental justice. So over these 3 years, I've gotten to know a lot about his work, and I can truly say that I think he's doing some of the most innovative work, especially when it comes to assessing exposure as they relate to climate change. So this is a real treat, and he's really not too far away. So, and I found him to be also a great collaborator. So that's just a little plug for Memo, and with that, I will give Memo the floor. Oh, and for those online, translation capabilities through Zoom are available. I can't tell you exactly how that works, but you can toggle. Yeah.
So translating from what to what?
From English into Spanish.
Okay. I can do it in Spanish.
Portuguese.
So thank you so much, Leah, and thank you everyone for attending today. It's really a pleasure to be here and present today about wildfire air pollution. If they told me it was going to be this hot, we probably should have chosen the impacts of extreme heat and cognitive function, right? But today, no, I'm going to talk mostly about what's happening with air pollution. And I think it's fascinating how a topic that you would consider dead a few years ago is now taking more relevance. So let me start by showing you an image that I find fascinating, if the clicker works. Don't worry. I don't know if it's an issue with the Zoom. Oh, okay. Yeah, now it's working. So this is the image, right? So at least this is my interpretation of the image. You have the wildfire going on. It became so close to a hospital that now you have people evacuating the hospital, right, and moving a patient out of it. So imagine like the chaos of this situation, and among all the things that they were worried about, they were worried about the air quality, right? So they were like cognizant enough to put some respirators. These are not face masks; these are respirators while they're moving the patient out, right? So there's certainly something in the air that, when there's a wildfire, people are worried about, and there's, as I will talk about, enough a reason to be concerned on what's in the air, right? So I structured the talk today in 3 parts to make it, I think, more well manageable to handle all these things. And let me just also say that Leah already introduced what my background is. So I'm a mechanical engineer. And I was talking to Anna about like how an engineer, a mechanical engineer, makes it into public health. And for me, it's relatively simple. I'm trying to solve things, and this is like an unsurmountable problem. So what you will see here are like a very discrete, I would say, manageable contributions to an incredibly large topic. So that's why I try to like make it a simple, divided into 3 parts. So the first one is, as an exposure scientist, the first thing that I have to ask myself is, are we doing a good job when monitoring this wildfire air pollution, right? Then I'm gonna talk a little bit more about, okay, we monitored and we're concerned about it because of the health effects, and I happen to be interested now more, I would say, exclusively to what's happening to our brain, to the human brain. So how is a wildfire differentially affecting the human brain and the associations with neurological outcomes? And then bringing it back to how can we actually do something about it, I want to ask myself the question of, can we develop, scalable technologies that we have at hand serve us to capture exposure and some changes of neurological function in real time for longitudinal studies. So let's start with number 1, and just as a refresher for people in the room that might be working on other stuff. So what's air pollution, right? So it's this complex mixture of gas phase and particle phase contaminants that, depend on whatever the source is, right? So you have carbon monoxide that is very toxic, and this is a function of the combustion efficiency of products. So I'm, as the topic says, wildfire, I'm gonna be focusing mostly on air pollution that comes from combustion sources, right? So these are some of the things that come, like nitrogen oxide, sulfur dioxide, volatile organic compounds. And maybe the thing that you have heard mostly related to air pollution and how we actually track air pollution regularly is using this metric called PM2.5. So let's see a show of hands. Who has heard about PM2.5 before? Okay, everyone. So universal. That's great. And we have to understand what we actually measure with PM2.5. So PM2.5 refers in most cases to the mass concentration. So how much mass there is in a given amount of volume of air of these small particles that are 2.5 microns in aerodynamic diameter or smaller, right? So these are really, really small particles. And you can see this in this diagram that within this fine category, PM2.5 and below, we have the particles that are mostly associated to health effects. And among those small particles, we have even smaller particles that I'm going to be also talking a little bit more about, that are these ultrafine particles that are about 30 times smaller than the PM2.5 cutoff, right? So they are really on the nanoscale range. So this is another diagram that has been shown extensively by the EPA, giving you the relationship of size to a human hair, right? So you have that they are really, really small compared to a human hair. They are not really visible by light. And then imagine that the ultrafines are even an order of magnitude smaller than that. So the problem with these small particles, what we understand about them, is that they are small enough that when we inhale them, they actually don't leave, right? So they are able to penetrate deep into the alveoli, the last part of our respiratory tract, and really cross that barrier that we have in our lungs, where we exchange gases, right? So when we breathe, the main function of our lungs is to take out the carbon dioxide that is produced by cellular metabolism and bring in fresh oxygen. So this barrier, a membrane that is just a couple really atoms in width, is very sensitive, right? And the smaller particles are really able to cross that. So that's an issue for health consequences. And the thing is that for a number of years, especially thanks to the National Ambient Air Quality Standard, the Clean Air Act, we're able to monitor these PM2.5 extensively. So we have quite a few of these monitoring stations, and they have chosen a PM2.5 especially out of convenience, if you will, right? So when you have this gravimetric method, the principle is that you suck air into a filter and then you collect the particles and then you put them on a mass balance and you know how much mass there was collected. So it's kind of a convenient, right, to monitor. We haven't had that advance to do so for ultrafine particles because being so small, they don't contribute much to mass, right? So you can have a lot of them by number, but they are massless almost, right? So this is a limitation, and this is why most of the health-based standards, either from the World Health Organization or the National Ambient Air Quality Standards in the US, are not doing any monitoring, extensive monitoring on ultrafine particulates. So that is becoming a problem because when it comes to health outcomes, mass is not the whole story, right? So we have had massive improvements in air quality in the last 20 years, the US, and I would say in many parts of the world, actually. The story is, I think, a story of success. And but the issue is that no matter how low these concentrations are, so in many cases they are close to background concentrations, it doesn't matter much what the anthropogenic contribution is, we still see the health outcomes, right? We still see mortality and morbidity associated with these PM 2.5 concentrations. So we don't know how much or how where else to intervene. So one of the things that is missing is the proper characterization of toxicity. Not all PM 2.5 is the same, right? So the toxicity varies by composition and by source. And the health associations from known epidemiological studies shift and vary the actual health effects when you take into account what's actually in the PM 2.5, right? So this is something that environmental epidemiologists start talking about lately, right? It's an ongoing topic that we need to move from just the typical characterization of PM 2.5 of mass-based standards and try to include more metrics, including size distribution, particle number concentrations, and actual some chemical speciation on the PM. This is probably hard to see for you guys. I don't know, can we make it a little bit larger? The screen? No, that's it. Is that better? Okay. Well, you will have to do it. So this is a study published in 2024 by the group of Michael Brower, and it's actually making that case. So they studied close to 2 million deaths in Canada across, I think, 20 years. And they tried to see what the associations were between the mortality and PM 2.5, and then including some constituents of PM 2.5 in specific sulfates and nitrates. So this table shows only two of the outcomes that they analyzed. So it's first all non-accidental mortality, and you see like the typical effect size associated to PM 2.5, right? So about 6% per 10 micrograms per cubic meter an increase, right? So the higher the PM, the higher the mortality. That's not new, right? But when they actually include the levels of sulfates and nitrates, the actual concentrations of these chemicals take out the actual effect, right? And then PM 2.5 stops being associated, the mass concentration actually being associated to the mortality. When they focus on specific mortality outcomes, in this case, cardiovascular mortality, you have, again, a statistically significant effect when you only have PM 2.5, but when you have a model that has both components, the sulfates and the nitrates, the PM 2.5 association goes away, and then the sulfates and the nitrates take up that association, right? And sulfates being more strongly associated to the cardiovascular specific mortality. They don't show it on this table, but actually they also did an analysis on cancer. And the opposite happened. The sulfates and the nitrates were non-significant, and the effect size of PM 2.5 went up. And the authors concluded that maybe there's something in the PM 2.5, these chemical components, potentially some polycyclic aromatic hydrocarbons or some other carcinogen that might be driving that association. So when we don't know it and when we don't account for it, we have biased estimates of the mortality from PM 2.5. I took too much time on this, but it was important. I know you're the AP people, so I think that's important to bring. So where does wildfire PM, what is the role that wildfire PM plays in this conversation? Well, I was just telling you that for years, we have seen declines, massive declines in the levels of PM 2.5 across the US. But unfortunately, since about 10 years ago, this trend has been reversed. And the effect has been so large that approximately in 3 out of every 4 states in the country, this trend has been either slowed or reversed, right? So we have an emission from wildfires that is so massive, that is negating it, that is really taking away the benefits from the Clean Air Act. So it's not a small issue. It's not a regional issue either, because this PM can travel, as we have seen, through hundreds, if not thousands of kilometers. It transforms itself chemically by atmospheric photochemical reactions and becomes really associated to bad health outcomes, right? So right now, wildfire PM exposure can dominate the total annual exposure in some regions of the country and can drive really extreme short-term peaks. And you might say, well, is it any different from traffic-related air pollution? And the short answer is yes. So the physicochemical profile of wildfire particulate matter, the wildfire PM, it's different than a regular, typical urban PM 2.5. We have lots of ultrafine particulates. So the ones that we tell you that we don't measure systematically, there's lots of them in a wildfire PM. So I would like you to focus on this panel of the figure. This is from our monitoring of the Canadian wildfires that we have almost 3 years ago in the summer of 2023. And if you remember, I think Philadelphia was also impacted by this, right? So the levels were off the charts. We monitor that with gravimetric methods. So we measure the actual PM, and to our surprise, even on these ultrafine particulates that we aren't supposed to see much mass, we saw mass concentrations on par to what we saw from the larger accumulation mode from 0.1 to 2.5 microns, right? So this was really eye-opening. It's a lot of ultrafine particulate in there. We see a lot of organic content on these particles because the combustion is very imperfect, right? So it's very different to have like an engineered combustion engine that wants to maximize combustion efficiency, that to have, you know, all sorts of combustion conditions when you have a wildfire. You have a lot of these PAHs, polycyclic aromatic hydrocarbons, that are known for their carcinogenicity and mutagenicity. So they are very toxic. And you have lots of them in these aerosols. So this is actually the analysis of those particulate matter samples that we took, the PM 2.5 content of PAHs. And it's a complex figure, but I would say the key takeaways is just the bulk concentration. So 54 nanograms per cubic meter is about 50 times higher than what you would normally have in Philadelphia on a given day. And we actually did this comparison to Los Angeles, right? So Los Angeles is not necessarily a clean city in air quality. It has still problems related to traffic and to industrial air pollution. And a number that we found for the average pH concentration, the average of the 16 pH priority list from EPA is 0.8 nanograms per cubic meter. So there's a huge difference in this. So there's another variant of concern within wildfires, and this is something that Actually, Leah and I experienced firsthand. We were in. We have that. Oh, thanks. We were in Santa Monica the day that the wildfire, these fires started. It started very small, and we could look at it from like the 13th floor of the hotel where we were staying. This is how the fires looked at 10 a.m. Just a few hours later, this was massive, right? And we knew that this was gonna be like a big thing. We had visits planned the next day to University of Southern California, USC, to UCLA, these like emblematic groups on air pollution that we were just, going to tour on those days. Well, it became completely different. And we had to reach out and ask them, is there something that we can do? We have like a bunch of air quality people in there. And they told us, well, actually we can't because we're evacuating our homes, our labs are closed, we can't really do something about it. So I had to come back to New Jersey, pack the lab in suitcases, and go back just 2 or 3 days later to bring the monitoring equipment and actually collect samples of what was happening, right? So Dr. Leo Calderon, a postdoc working in my lab, and in collaboration with a professor at UCLA, we did this sampling campaign, right? Very similar to what we did when the Canadian wildfires hit us here in the Northeast. And through January 16 and 22nd, this was still when the wildfires were active. We collected lots of samples for analysis, right? And the first thing that was very impressive about this event is that you see here in the black line, these are the PM 2.5 concentrations from a nearby EPA station. So if you see, this is before the fires, and you see after the fires, even this red line shows you the percent containment. So while the fires were still active, air quality by the standards that we use was not bad at all, right? Actually, this is another way of looking at it. This is the week prior to the fires. You see this yellow. Yellow means regular, moderate. After the fires, but still with active fires, we're in the green zone, right? So the messaging was that, okay, you see the skies, they are kind of black, you saw the picture, but their quality is actually not that bad. Well, turns out that wasn't the case. So we did the analysis, right, of small levels of PM 2.5, but actually to take a closer look of what's in them, right? So we do this classification of PAHs on 4 categories. The legacy is what you normally see from EPA. It's a list of 16 compounds. And compare them, so the legacy compounds, alkylated compounds that are also associated with inflammation, mostly they're very irritant. Oxygenated compounds, these are very novel. Normally, we're finding the toxicological effects of this category, and the rest we categorize them as emerging. So, for example, rethene that was dominating the biomass-only profile from the Canadian wildfires dominated that event. It wasn't so high for the LA fires, right? Obvious reasons, we were burning cars, homes, all sorts of structures. More than 16,000 structures were burned in this event, right? So, since the volume concentrations, the micrograms per cubic meter were kind of deceiving, we looked at what's in the PM 2.5 per gram per unit of mass of the pollutant, right? And it turns out that these PAHs, the concentrations were close to 80% higher than in the wildfire, the Canadian wildfire event. Then for the risk assessment people in the room, we did the estimation of the BAP equivalent. So BAP is like the reference PAH to understand the risk of cancer and other mutagenic outcomes. And when we did that estimation of the total PAHs, just considering the 16 priority list, so in this case, 46% on the ultrafine and 70% on the other size fraction, these were 18 times higher compared to the Canadian fires, right? And a similar comparison was with the actual traffic air pollution from LA. You remember that 0.8 nanograms per cubic meter? Well, the concentrations were one order of magnitude higher in concentration, and the BAP equivalents were also about one order of magnitude higher. So very toxic air pollution. And then probably a little bit more concerning is what we did with metal concentration. So this plot is showing you the split between ultrafine particulate and the accumulation mode. And the vast majority of the metals, and these are like heavy metals and non-crustal metals, so the ones that are potentially associated with neurodegenerative outcomes, for example, they are primarily in these PM.1, the ultrafine fraction. So lots of ultrafines loaded with metals. And we did the comparison. This is a paper that we just submitted to the Journal of Hazardous Materials. We compared it to different biomass-only fire events at the PM2.5 size fraction and ultrafines. And if you see the enhancement ratios, so how much more of these metal concentrations there were in these two size fractions go from 1 to 3 on the logarithmic scale. So even 3 orders of magnitude higher of concentrations in ultrafine particulates from these WE events. So closing on the first question, are we doing a good job monitoring the PM? I would say not really, because this is a completely new challenge, right? Then the next question is how does this exposure to wildfire pollution, to these physicochemical properties that are unique in wildfire PM affecting the human brain, right? So I already told you there's this mechanism that is hypothesized in which the air pollution that we inhale can really be detrimental to neurological health. So we know what the effects are to the respiratory system, to the cardiovascular system, but the problem is that if you have these high concentrations of ultrafine particles, they can either go directly to the brain through the olfactory bulb, or become systemic through like the circulatory system and cross the brain-blood barrier and make it into our brain, right? So unfortunately, since this is kind of a novel topic, we don't have full evidence of the causal mechanisms behind the exposure and outcomes. The topic is certainly, I think now well researched, not comparatively to other health outcomes. So this is the typical graph from PubMed showing you the number of articles in a given with given keywords, and you see like the majority of the health-related air pollution studies are from cardiovascular and respiratory. But just since like about 10 years ago, there's a lot more emphasis on what's happening to neurological outcomes. So this is an ongoing area of research. I think it's very promising, if you ask me. There's evidence from epidemiological studies suggesting that the associations between PM2.5 and incident dementia is stronger when you apportion the PM to agricultural fires and to wildfires compared to traffic air pollution. So there's the epi signal in there for sure. And there's also like a broader literature linking long-term air pollution to cognitive decline and neurodegeneration. There's quite a bit also on post-mortem studies that link when they like see these brains of people that died of accidental causes, mostly younger people, they see the particulates in there. Unfortunately, these studies can't really relate to an Alzheimer or to an dementia outcome. So they are proving that the PM can make it into the brain, but not necessarily that can lead to neurodegeneration, right? And then you have a lot of in vitro and in vivo studies with animals, showing you that there's a potential for these neuroinflammatory mediated mechanisms or the generation of reactive oxygen species. So there's certainly something that is very suggestive that the association is real, right? But we need to connect these measured properties. So on the regular epidemiological studies, there's not that level of speciation on the exposure, right? On what's on the PM 2.5. So that's something that is still missing. Then there's also evidence that not only chronically, but acute exposures to wildfire air pollution, wildfire-related air pollution, this RAP term that is also used, is associated with reduced attention and other cognitive function outcomes just within hours or days of exposure to these concentrations of wildfire air pollution. There's reported effects on mood, headaches, sleep, cognitive performance, all these like neurological related outcomes just from a few hours of exposure. So to me, this is a good combination of findings that kind of suggest that we could do something different in terms of how to find a causal pathway linking the air pollution exposure to the outcomes of interest, in this case, neurodegenerative diseases. So this is my approach, right? And I think it took too long to actually tell you what I'm really doing. Well, the air pollution monitoring is also I'm doing. But the idea here is related to health. I think there's a really untapped possibility to know what's happening by doing control exposures in human subjects. So this is controversial for sure. But I think when you really take a closer look at what we get exposed on a regular basis, you would say something like this kind of makes sense. So let me guide you through what you see here. This is a let's call it a wildfire simulator. It's a platform that is able to generate wood smoke with conditions that really resemble what can happen in a real wildfire. So we're able to modify the amount of oxygen and nitrogen to simulate pyrolysis. So this combustion that is taking place without any oxygen in place. So very, very low levels of oxygen. We modified conditions to simulate smoldering. So these low temperature combustion or flaming high temperature combustion. We can certainly modify the fuels amounts, flow levels to really have control of a variety of conditions that we care about. So these size distributions, how much and what ultrafine particulate we get into our exposure chamber in a very repeatable and controlled fashion. So for those of you that were nervous about this exposure to wood smoke, I can tell you a couple of things. Believe it or not, it's kind of pleasant. The first subject to test the chamber was myself. So it's just like really being close to a fireplace, and that was actually our ethical standard. This wouldn't be higher than someone being exposed for an hour right next to a fireplace, right? So that's what we're doing. So the exposure is actually pretty low. Low risk, or the high risk is that I don't find anything. That's the highest risk, right? And that I just lose a bunch of time and money on this. But it controls so many different variables, right? In terms of exposure. So what we did is a crossover study design where we have two conditions: ultra pure exposure for a period of 1 hour, and exposure to 300 micrograms per cubic meter of PM 2.5 wood smoke. So the idea is that this is what the protocol looks like for each time the subject comes into our lab. So it comes for two trials. These are blinded and these are masked. So for the ultra pure air, we introduced just the odor, but not the particulates for just like 1 minute to give the sense that they're getting exposed. It worked. The blinding worked, so we're very happy about that. And before exposure, we take blood samples, urine samples. We do a cognitive test. We are measuring brain activity using this functional near-infrared spectroscopy. We measure a heart rate variability just for safety purposes, and a survey on like a bunch of stuff, the sleep quality the night before, etc. Things that could be associated with cognitive function. That is one of our primary outcomes. Then we have during the exposure, just a subset of those metrics, and then 4 hours after, they have to come back, give blood again, give urine again, and repeat basically the thing without getting exposed, right? So we do these crossovers. Some people start with exposure, some people start with the clean air. We did this last fall. We finished a pilot on 12 subjects, and before I jump into it, it's very promising. So one of the things that we are analyzing in the blood samples is just in the past couple of years, FDA approved a biomarker of Alzheimer's in plasma, a phosphorylated tau, and we saw even at these low-level acute exposures a significant difference in the exposed group versus the control. So really the way that I'm approaching this is that to extend this hypothesis to animal models to see if a chronic exposure of this, like a repeated hit from these exposures, can really lead to neurodegenerative outcomes. So stay tuned for the rest of the results from this study. And then the final part of the presentation is really related to how do we make this practical. So bringing people to a chamber to expose them to smoke is not practical, believe me. The way that we measure air pollution, I already told you, we don't have the infrastructure to measure these ultrafine particulates at large scale. So we're failing that. And then lastly, in order to really have an assessment of whether people are experiencing some changes in their neurological outcomes, this is a very hard thing to do. What we do right now is we diagnose people when they are already experiencing dementia or Alzheimer's, and the symptoms are there, right? Most of the research that I'm familiar with says that the initiating events happen years, if not decades, before these cognitive outcomes are already too visible, right? So the question is there something in scalable technologies to change the way that we measure exposures and outcomes for these particular neurological diseases? So to close that exposure metric gap, this is what I have talked about. The studies rely on the monitoring PM2.5 network, or some other approaches are to use satellite-based models, chemical transport models, but we are not really getting at the characterization that we need for this fully characterize this uniqueness of the wildfire air pollution. So what I did is coming back to this model, and to make sure that this was actually safe, as I was telling you, we had to repeat this experiment 70 times, right? So while we did that, we put inside a suite of low-cost sensors to actually train models on the combination of gas and PM2.5 parameters to being able to characterize that ultrafine particulate matter, right? So we are using these random forest models and gradient boosting models to predict the ultrafine particulates. We're not measuring them because measuring them requires this device, the SMPS, that is $100,000 and that you cannot bring around. But actually what we did is, let me show you, jump to actually what this looks like. So my team actually put this Frankenstein of a sensor first, And then we saw that it was promising because the results of predicting the ultrafines were really good, especially when you know the source. And we really miniaturized the device. This is our working unit that will go next month to Harvard Medical School for a sleep study on premenopausal women and heat and air pollution. So we have a first collaboration with our device. This is just to show you, this is the comparison of the predicted to the actual levels of ultrafine particulates in different size beams. So this is really promising because it really shows that we can leverage a lot of already collected data to predict these ultrafine particulate counts. Then last, to address this issue of how do we actually monitor the cognitive function of people, there's this also ongoing field of speech analytics, right? So we're talking over the phone all the time, and something that AI models are extremely good at is, they're called large language models, right? So they're very good at understanding language. So you can really extract very fine acoustic, phonetic, and linguistic features from any type of speech, and basically from any type of language. So what we're trying to use is to grab those voice recordings and relate them to validated scales of neurodegenerative disease. So the first experience that we had was with a colleague at Rutgers. He did this study where he's a kinesiologist. So he wanted to see if the motor deficits of someone with a cognitive impairment could predict the validated scales. So he did a thing where he put his healthy, mildly cognitively impaired, and diagnosed Alzheimer's patients to do a dual test. So he put them to move the arm and then to do a digit backward counting test. So you start from a given number and then you subtract by a certain, like I think it was with every 3, right? So you start 300, 297, 294. And he found that just the cadence and the metrics associated with the movement were predictive of the MoCA scales, Montreal scale for a cognitive decline. And he could do the classification of cognitively intact and cognitively impaired just based on the angular velocity of the arm and some other features. But that's not the point. The point is that he was lazy and he never used the actual speech recordings of the counting backward test. So I said, can we look into that? And we looked into that, right? And fantastically, we got some incredible results. The first thing is that the counting backwards tells you something, but actually, the richness in the speech, when someone says "Oh, I'm sorry," or that it starts repeating these sounds, every single every single every single pause that we can measure in milliseconds is predictive of the outcomes, right? So the next, we have this classification accuracy of the mildly cognitively impaired and the Alzheimer's patients with incredibly high accuracy, I would say. So we're now trying to see if the hybrid model with the arm and the speech gives us some even better results. But you see the picture. The picture is that we can have in prospective longitudinal studies people using or relying on low-cost sensor networks that have better spatial and temporal coverage. We can have outcomes or I don't know if it's the right way to call it, but biomarkers, digital biomarkers that track people over long periods of time. This is a structured test, but also the next frontier is to see if this can be done with a spontaneous speech, right? So I think overall, it kind of rounds the whole approach to exposure assessment. So recap, are we doing a good job monitoring wildfire pollution? I would say not yet, but we can do it. We have like promising methods to at least improve the way that we are characterizing that air pollution, not exclusively wildfire pollution, but I think it's the one that is more of a pressing need right now. Then I think the controlled human exposure is an alternative and kind of a bridge to see if these effects that we see just from a low level acute exposure and the biomarkers and hypothesized mechanisms can really mean something for chronic long-term exposures. And finally, yes, I think that we can use scalable technologies, low-cost sensors, wearable devices, smartphones to create new study designs that follow prospectively people for longer periods of time. So one more thing, acknowledgement. So lots of people, as you would imagine, are associated to these studies. Our postdoc, Luis Bisani, he's been doing most of the analysis related to the LA fires. Same with Milton. People from UC Davis were actually collecting a lot of ashes. I didn't talk about ashes, but for the particular case of wildfires, ashes is a major thing. Mohamed Balusha is helping us with the analysis of metals. And my colleague, Professor Philip Democritou, he is really overseeing most of the toxicological characterization of these samples. And I want to extend to all of you the invitation to a wildfires and health symposium we're hosting at Rutgers on May 6th. There's the two formats. You can join us in person. We'll treat you with lunch, or online if you cannot make it, but it's not that far. And we're going to have like lots of people from NIH programs, NIHS, NHLBI, lots of interesting people, lots of speakers on different aspects of toxicological assessment, epidemiological studies, air quality modeling, impacts of wildfire aerosols on climate change, etc., etc. So that's it. Thank you.
I think we have some time for questions if folks have. There are folks online too.
We're monitoring the chat. We have a hand raised online.
Okay. Let's see. No?
Katie just clapped.
Oh, okay.
Yeah.
Yeah. Those are welcome.
Well, I'll ask a question if folks don't have, of course, others don't. I do a lot of. So as you know, I do a lot of work on heat and thinking about adaptation and policies and interventions that we can do to protect people in the short term. And I'm not super familiar with wildfires and sort of the conversations there. And so I'm wondering your thoughts on that. So in the short term, knowing that these wildfires are happening and they're dangerous,
yeah.
Beyond, maybe monitoring them better, I'm wondering what your thinking is there.
Yeah, so certainly filters, like using air purifiers helps a lot. I think I was just discussing with Professor Anna on how COVID was just a missing opportunity to like really focus on what we do regarding our indoor air quality. Ideally, you have these like strategies already implemented in your building, right? So the efficiency rating of the filters in this building should be like, responsive to air quality episodes. That's one thing. The only thing that I still think it's an unknown is these filters are very good for the particulate phase of the pollutants, but not for gases. So all the gases will make it into these places, and also this has been documented before. So we need like engineering solutions to be able to reduce concentrations, primarily indoors. I would say that the focus would be to tell people to minimize activities outside, right? And I actually think that the air quality index, given what we're seeing, gets like a revamp or like, you know, other color scheme when you have emissions that are not the typical ones. That might not be as difficult, you know, even like, I don't know, change the thresholds. Yeah.
Well, if they're very interesting, thank you for sharing with us. I would imagine the composition of the wildfire articles, I mean, very different depending on what's being burnt.
Correct.
Right? So what are the implications of that for like even these chamber studies? You know, I'm just thinking how this would feed into, in the ideal world, into EPA regulation. Given the heterogeneity of the composition of these particles, I don't know, do you have any thoughts on that?
I do. I don't know if this is the right way of thinking about it, but yes. So all these parameters that platform that I showed can vary. Those are influential, right? So fuel type, humidity content of the fuel. We can go through a very extensive list. To me, there's two ways of looking at this. It's very hard to monitor all these conditions in the field, right? The platforms might have some limitations, right? But you can simulate these conditions, right? And know what are the toxicological effects, and maybe do like an ensemble model once you have like enough parametric inputs into a study. The thing is, if you know EPA in the Triangle Park facilities that they have at UNC has like lots of these and more sophisticated exposure chains. And I think they are idle now. I think actually they're going to shut them down, right? So yes. UNC cannot, as far as I know, fund keeping the building, and EPA is not using it. Has no budget associated, right? So I think yeah, we should make more use of this type of simulated approaches.
Because in the, you know, I was on KSAC, the Clean Air Scientific Advisory Committee, you chaired it for a couple of years too, and you know, you may be aware, people may be aware that there's a big pushback against observational studies. Course now, but there always was, you know, some, and the exposure, you know, chamber studies were always highly emphasized in the reviews, and so I think it's
positively or negatively.
Sorry,
positively or
no, positively,
okay.
Because people tended to like that it's an experiment as opposed to the observation. You know, I think both things are important.
I think complementary.
Yeah, they're complementary, but it was certainly a very important component. Even then, before there was this, you know, huge critique, you know, observation studies, which is another conversation. But so I think it's a really important element to keep going.
Yeah,
evidence from those.
To me is I've been an advocate for these exposure assessment methodologies, because the limitations, I think, from the observational studies is that in most cases you have small panels, right? Comparatively speaking to an epidemiological study, right? So they are kind of in the middle. They are not controlled. You have lots of variability. But if you were to have like a little bit of a hybrid, let's say, right? So you follow larger numbers of people with devices that, you know, almost have, right? So it's kind of another approach to maybe you know, up the numbers and have like much larger observation stuff.
I want to ask about the because you know the work you presented most of it with the US population. How do you see this? I mean, I'm thinking now of levels of air pollution in the US are
Very good.
big something, right? Compared to Latin America, compared to India and other places. How do you see the applicability of what is done here in places where levels of PM are 10 times higher for example,
Sure.
or the other way around? That also happens frequently.
So I think there's still a lot to be done on these low-cost sensor networks. The example that I have, that I know the best, maybe it's not the best example, but it's from Taiwan. So Taiwan, they have, like, from 10 years ago, one of the largest networks of these low-cost sensors, right? And if you see their improvements on air pollution, they are remarkable. In part because of the reduction of air pollution from mainland China, but also like their efforts are pretty amazing. So I think if you ask me for the context of Latin America or so, it's worth having the discussion if regulatory agencies are able to manage the imperfections of these networks and say, for the sake of monitoring, maybe the signal is good enough. And these devices have improved remarkably over the years. Also from my conversation with Anna, I've experienced the evolution of these CO2 sensors, carbon dioxide. When I started my doctoral work not so long ago, maybe I look old, but it wasn't that long ago. The CO2 sensors were like these brakes, right? And they were $800 from a company called Teleair, right? And they found a commercial application. It is called demand control ventilation. So in a place like this, they put a sensor and tells the CO2 is a proxy for occupants. So it tells you approximately how many people are in the room. So they vary the amount of airflow that goes into a place. That was the driver for having remarkably better and way cheaper and smaller sensors, right? So that's the same thing. If you transition the bulky, extremely costly regulatory monitoring sites to advance the use of and the development of local sensors, I think there's an opportunity there, right? In particular to gases and a few parameters. NOx, we don't have a good one. SOx, I think is still working in some of these cases, and PM. Yeah.
All right, well, thank you so much, Dr. Cedeño, for joining us. As a reminder, we will have our invited speaker next week, Dr. Mariana Arcaya. She'll be joining us from MIT next week, so please join us for that. And then also, if any of you are joining us at Lemongrass Thai for our monthly social, just remember that we always go out to lunch the first Wednesday of every month. So today we'll be in the lobby and then head over at 12:15. By show of hands, who's planning on going to that so people know who to look for? Okay, cool. So maybe we won't be going to lunch. But if there's nothing else, thank you so much for joining.